stroke. In this episode, we're going to talk about the difference between primary and comprehensive stroke center. So how do emergency medical services team decide which hospital an individual who might be having a stroke goes to? They perform a physical exam, rapid one, on the scene, and their tool is called Prehospital VAN Stroke Assessment Tool. And the VAN is an acronym. It stands for vision, aphasia, and neglect. These, amongst many others, are known as cortical signs. So briefly, we can divide stroke into two categories. One being cortical stroke, stroke that occurs on the cortex of the brain, involving the very top portion of the brain. And two, subcortical, stroke that occurs under the cortex, involving, critical, everything is critical in the brain, but the white matter tract, the one we talked about, the lacunar stroke, which are in the basal ganglia, thalamus, brainstem, and the cerebellum. These are all under the cortex, so they're called subcortical stroke. The EMS team, when they show up on the scene, they run the VAN assessment tool to see if the person is having a large vessel stroke. And as we talked about, the large vessel occlusive stroke gives us what is called cortical sign. So the V in the VAN stands for vision. So the individual might have a visual field cut. They could only see either the right or the left part of the world, or their eyes are now midline and they moved to the one side. Either they have a left gaze preference or deviation, or a right gaze deviation or preference. And also the individual might also complain of double vision, or they might have what is called nystagmus, where their eyes are kind of dancing. These are all signs of a large vessel occlusion. So the A in VAN stands for aphasia. Aphasia means disorder of the language center. An individual who might be having aphasia will have difficulty in communicating or producing words, or receiving information, understanding what is being said to them, or understanding instructions. Neglect is the N in VAN, and the individual who might be having a large vessel occlusive stroke can neglect the left or right side of the world visually, or neglect the left side or the right side of their body. And sensation, when you're touching them, they might not feel it, this part of the body. So if you think about executive decision always coming from top to bottom, all the important higher cognitive function live on the cortex of the brain. And when you have a large vessel occlusion, you lose this higher brain function or higher executive function. What are considered large vessel in the brain? These include the internal carotid artery, the M1, which is the first branch of the middle cerebral artery, M2, the second branch of the middle cerebral artery, A1, which is the first branch of the anterior cerebral artery, the intracranial portion of the vertebral artery that feeds the back of the brain, the first branch of the posterior cerebral artery, or the P1, and the basal artery. These are all considered large vessel. All of these are proximal. That means they are at the base of the brain. If they're occluded, everything else that's supposed to branch off of these arteries and feed the rest of the brain would also be occluded. So if we occluded the internal carotid artery here, everything else that is supposed to branch off and feed the rest of the right hemisphere would also be compromised. And if nothing is done about it at the right time, all of this territory will be at risk and it could die. Large vessel occlusion are estimated to account for at least 38% of acute ischemic strokes. Over the past several years, multiple randomized controlled trials have shown us the efficacy of mechanical thrombectomy for people who are having a large vessel occlusion. Initially, the treatment window was within 6 hours, but now with more trials, we have seen that we can expand the window up to 24 hours for individuals who are having a large vessel occlusion. So what this means is, if the person is having a large vessel occlusive stroke, we not only give TPA if they're within the window, but we would also perform endovascular thrombectomy, which means we access the artery and we go in and we remove the clot. We suck the clot out mechanically to help the patient have a better outcome. So now you can see why it's so important for the emergency medical services to do their pre-hospital VAN stroke assessment on the scene to see if an individual is having a large vessel occlusive or cortical signs, to take him to a comprehensive stroke center. So now let's talk about the difference between primary and comprehensive stroke center. So both of them, to have this designation, is an honor, And it takes a lot of hard work and teamwork to make this happen or to obtain this accreditation. And these hospitals hold these accreditations with such great pride because they're able to provide the stroke services the community needs. So imagine if you live in a small town and you have one hospital, and that hospital is not a primary stroke center. That means if you or someone near you is having a stroke, then you would not be able to receive treatment at this facility. That means that the EMS team would have to fly you out to a farther hospital, which will take more time. And we know time is critical in stroke because stroke is an emergency. Every minute counts because every minute neurons are dying without oxygen, without nutrition. So it is a great honor to have hospitals near us for us that will provide these services for us at a timely manner. So if you or your loved ones are having a large vessel occlusive stroke, you'll be taken to a comprehensive stroke center because you will need a procedure to remove this clot, and primary stroke centers do not provide the services. So primary stroke centers provide basic stroke treatment. So let's say you're having a subcortical stroke, but you're still awake, your eyes are midline, you're able to communicate, but you're having a stroke. Your right face is weak, your right arm is weak, your right leg is weak, you're slurring your speech. These are stroke symptoms. They can be managed at a nearby primary stroke center. So if you show up within the 4.5 hour window, you will receive TPA for this. Now, when they're doing their investigation, they found out you have a large vessel occlusion. Maybe let's say you have a left M2 occlusion. Then at this point, they will fly you or move you to a nearby comprehensive stroke center for endovascular treatment to mechanically suck out that clot for you. The primary stroke center will have a 24-hour CT scan available just to scan the stroke patient. They will have a 24-hour stroke team available to evaluate the patient who come in with stroke-like symptoms. And they would also have a stroke unit where if you receive TPA, you will be monitored for 24 hours closely for complications that are related to TPA. Comprehensive stroke center, they handle ischemic stroke, which is what is handled at the primary stroke center. They are also able to handle hemorrhagic stroke or stroke that is devastating, that requires higher level of care, multiple specialists involved. So at a comprehensive stroke center, you would also receive TPA and receive mechanical thrombectomy. You would also receive surgical treatments. Let's say the stroke is huge and has caused your brain to swell. In this moment, you might require surgery from a neurosurgeon. Comprehensive stroke center are required to have a designated neuro ICU for their patients because they're handling more critically ill patients. They're also required to have 24-hour CT scan, 24-hour MRI. They would also have to have 24-hour operating room and staff available to perform mechanical thrombectomy or surgical intervention if the patient's needed. The neurosurgeons have to be on call, or vascular neurologists have to be on call 24-hour. Also, comprehensive stroke centers are required to improve care by performing research so that they can provide a better care for their patient in the future. Thank you for watching. I hope you found this information useful. On the next episode, we will talk about stuttering stroke or capsular syndrome. Always remember to dial 911 if you or someone near you suddenly can't see, can't speak, can't walk, or can't feel. Let the operator know that you or someone near you might be having a stroke so that you or the individual near you can be transported to the nearby comprehensive or primary stroke center for rapid stroke analysis and tailored treatment.